I'd like to now introduce Bill. Bill Bowtell is Adjunct Professor of UNSW and a Strategic Health and Policy Consultant. So I actually greatly admire Bill. He's been actually a very supportive mentor actually over the last few months. And he's quite a big name in public health, and I'm very passionate about public health, having nearly finished my Masters of Public Health. So Bill, if people aren't aware, played an instrumental role in Australia's world-leading HIV campaign in the, was it the late 80s or early 90s? Yeah. And he's a seasoned policy advocate and strategist and has spent many years in the thick of it. So the political game playing that comes with public health decision making. And he's always been unequivocally on the side of science and of ensuring that governments fulfill their obligations to protect citizens, so us. I think he's incredible force and has amazing achievements in public health. More recently, during COVID, Bill from the beginning has been outspoken in his criticisms of the government or the government's handling of the pandemic. And Bill's recently published book, which a link will be put in the chat as well, is Unmasked: The Politics of Pandemics, which was published last year, early last year, details this criticism. But in short, it's really that Bill's statement is that nature creates viruses, but people and politics create pandemics. And two other sayings I've heard Bill state, and that really stuck with me, always stuck with me, is, and I think which encapsulate Bill's views, the greatest vaccine is money, and the best way to live with COVID is to live without it. So it's a great honor to have Bill and to have him here to share the benefit of his expertise in policy advocacy. And particularly as we enter the pointy end of our campaign, it's been an incredible roller coaster of a week, and we really appreciate Bill joining us. And I'll hand it over now to Karen, and thank you to Shane for joining us. I really appreciate. I've been following your Twitter posts with interest, and there's been some great advocacy there too. So Karen, I'll hand it over to you.
Thank you so much for joining us tonight, Shane. We're so thrilled to have you. So Dr. Shane Huntington is a successful broadcaster and communication specialist based in Melbourne. He's the CEO of Little Big Kids, which is a children's cancer charity. And in 2020 was awarded the Medal of Order of Australia for service to science as a communicator. Recently, Shane has become a tireless advocate for a safe school strategy, which prioritised the needs of children and teachers. He published a powerful letter to the Victorian Minister for Education earlier this week, which has had widespread media coverage across TV and radio. And we thank Shane very much for joining us tonight and welcome him to speak to his advocacy and the response that he's received in recent days across Australia as to where we might be heading. So we might start the conversation with the question from Jane. Thank you.
So I'm interested to hear about both of your experience in policy advocacy and campaigning on this issue particularly, but other issues. I know that you both have particular interest in health, public health, and I'm interested to hear your views on what you see as the role of advocacy groups like COVID Safe Schools, and how do we get a seat at the table when and be taken seriously when there are so many powerful sort of lobby groups and forces vying for a position, and particularly as government is demonstrated they're not interested in the science, they're not interested in the facts. And so if you could comment on those two questions, and we'll start with Bill, if that's okay. Bill.
Oh, well, Jane, Shane, Karen, Elizabeth, thank you so much for inviting me along tonight. I realise you've got a big agenda, so I'll try to keep it short and sharp and to the point. For firstly, it's wonderful that COVID Safe Schools has come into existence in this, what is the third year of this present pandemic. COVID Safe Schools, and what we're seeing now in the last several months, probably since last June, when wrongly the governments of Australia, New South Wales federally, decided to let COVID Delta run in an unvaccinated country. I think that what happened from about the middle of last year is the community started to mobilise and to demand to be involved in the creation or in the further development of this response. Now, as Jane said, I was a small cog in the big wheel of the HIV response 40 years ago now, goodness me, since the first case was identified in Sydney of what became known as HIV. But I worked then for Dr. Blewett, a great guy who was the Minister for Health in the Hawke government, and with the Hawke and Keating cabinets, and with the opposition of the day under Peter Bowman, Andrew Peacock and so on. And the core of the response to HIV in those days, another virus that came out of nowhere and started to wreak havoc, was the creation of what we called the partnership. So there was the partnership between government and governments, and in Australia they were the federal and state and territory governments who had the money and sort of had to do something. Then we had on the other side the scientists, the clinicians, the doctors, the nurses, the carers, but particularly the researchers and the doctors who are right at the front of trying to cope with this. So that's good. Science, medicine, the governments. But imperatively, and so importantly, we had the community. The communities who were most immediately affected in those days, gay men, people with haemophilia, of course, because they were being infected by infected blood transfusions and so on, sex workers, injecting drug users, and the broader community as it evolved in those days. So it's a triangular structure, this partnership, and like triangles, it was extremely powerful and strong. There was an enormous amount of to and froing about really difficult policy decisions. We had a virus, but it's transferred very easily by sex and injecting drug use. And so it took an enormous amount of discussion about things that were extremely controversial, and in most cases in those days illegal, but it took a tremendous coming together of all of those forces, and in relatively short order, we restored some order to the chaos that had enveloped us in 1983, 84, and bit by bit, we implemented what were very radical and bold policy initiatives, but making sure we were working on the basis of maximum transparency about the science, about what we knew, and more importantly, what we didn't know, maximum truth telling, a minimum of secrecy. Things weren't far from being decided behind closed doors. They were decided in endless public debates between the community, the scientists and governments about what to do and what we should basically do to stem new infections and to control deaths and so on. But it was enormously powerful and enormously successful. And the basis of that response of the 80s has been laid down in Australia for 4 decades, supported by politicians and parties across the spectrum, with very few exceptions. And over time, we've saved many hundreds of thousands of cases of HIV in Australia, and certainly in the early days, many thousands of people going unnecessarily to illness and early deaths, as occurred, unfortunately, in the United States of America. So to me, using the great strength of our public health system, our scientists, working with and around governments, not party political way, but of all persuasions, then and now, but imperatively to involve the community. The community is not the object of all of this. and required to do what they're told to do by governments coming out with press releases and telling them what's going on and what's expected of them or they'll get fined. We never did it that way in those days. The community was pivotal and central, both in terms of changing behaviours and sustaining those behaviour changes, and very importantly, the broader community in Australia, by being open and truthful and honest, we had to get the permission of the broader community to do things that you would think were very radical and bold, needle and syringe exchanges, talking about sex and homosexual sex, talking about sex work, talking about all sorts of things that you wouldn't have thought were going to be well supported, but in fact the broader community gave their permission because they understood the urgency of the problem and the need to talk honestly and to create sustained change. Good, that was 40 years ago. When this came along, what was so apparent from the earliest days in Australia, we had governments operating behind closed doors. Some of this was in the national security, it still is in the national security structures of cabinet. The people were on the advisory committees, their names are not known, their positions are not known, you know, who they are and where they are and what they represent. And the advice upon which so much depended was kept secret. And these things would be, what was decided would be announced in the early days by ministers coming at 10 o'clock at night and going through a list of points in a thing, as if we were supposed to sit back and say, oh, that's fine, that's good. Well, of course, in the early days of the epidemic, the government tried that to say that we had to accept the United Kingdom approach, basically, let it in, let it run. And there was a revolt by the public health system and the premiers who decided that in those days we'd go to lockdown and we would keep COVID out till we could figure out what to do. And we saw how that developed over the years of zero or low COVID eventually. But what was always missing in those 2 years, in my view, was the involvement of the community. And that fell in a heap. We saw the results of that from last year. And now we see, as we go into the third year, really strong problem. Schools, children, aged care, people whose lives and health are being upended by this thing. Changes in policy, struck behind closed doors. People expected to change, to swing on a dime from what was before to what was now and to what's coming. No truth being told, really, no transparency, and then a complete abandonment of trust. And therefore, to bring all of this to a point, what is now imperative is that through COVID, safe schools and people involved in aged care or in the unions, the workers, all the people whose lives are now faced with this tremendous upheaval in the third year have got to come right back into the centre of things. This cannot go on like it's been going on. And it's going on because the decisions that are being taken are not very good. All politics is basically about decisions about money and, you know, decisions. And the point I was trying to make with Jane before was that viruses come along all the time. But what we're suffering through now is the consequence of deliberate decisions made behind closed doors without the permission or involvement of the community or the understanding or the pros and cons being put out in front of us, and then these decisions being taken and announced. Well, we've seen how badly that went from the 15th of December. 4 weeks later, were we better off 4 weeks ago than we are today? The answer to that is yes. Are we going to be better off in 4 weeks' time and 4 months' time? Well, only if people like you and the broader community just put themselves right back in the centre of this and say there are things we're not going to accept and we want to know the reasons, we want to understand the consequences of the changes that you might be thinking about, because so far it's not been really good. In my way, that strengthens the public health, puts public health at the centre. It's the great jewel in the crown of Australia, the Australian public health system. So you can imagine my reaction to the idea that a clinically required good like a rat test is somehow to be charged on the family budget as if it's a privilege and not a right to have it. Imagine if we'd charged $10 for a condom or $20 for a clean needle back in the worst days of the HIV epidemic. Thousands would have died and the thing would have collapsed in a heap. So all of these principles have to be re-fought for, and the people have got to be right up front. And however hard it is to come to an agreed position, and I understand it's always difficult, but that debate will engender trust and truth. And if I can say anything, you know, to you and your colleagues and your friends is let's just get on with it now and understand that the politicians of Australia in the end work for us, we don't work for them. And their record to date, particularly in the last 6 months if you're in New South Wales, and particularly in the last 4 months in all of Australia outside Western Australia, has not been anything to write home about. So it's time for a big change. Thank you.
Thank you, Bill. And yeah, I really am hoping for some, there's a shift, that we can contribute to that shift. And I think our efforts, while we're not getting a seat at the table necessarily, I think the legal side of things, we're trying to demand the truth and demand action. So hopefully something will come of that. So I'll hand it over to you, Shane, and for you to respond. Thank you.
Thank you, Jane. Well, I guess instead of a response, I'll add to what Bill said, because I don't think I picked up on anything there that I would disagree with or take any issue with at all. One of the things that I was reflecting on today is an area of expertise which I have, which I sort of rely on a lot around communication. This is something I've been doing for a very long time, been doing my radio show for 30 years, which it's still disturbing to say that because I realize that's more than half of my adult life. But communication is so important, but some really interesting features of this have come out in the last couple of years. So one of my big critiques early on in the pandemic, and I'm sure Bill will probably agree with this, is that the standard of communication being delivered to the public was no less than appalling. It was confusing. It was often difficult for the public to engage with. And it was very problematic for people to be able to understand exactly what was going on, and it kept shifting. For a good example of this is the ATAGI committee, which is very, very important in the way we go about, navigating this pandemic, does not have a single communication expert on its main panel. And one of the letters that I didn't publish publicly, but I sent to Minister Hunt was, desperately pleading for him to put communication skills onto that panel, because the way in which they were distributing information, especially around the AstraZeneca vaccine, was causing incredible levels of fear that were unjust and inappropriate. And there are many, many examples of that. But we're moving into a new phase now of communication. This is something that I find even worse. And it feels like I've stepped into a George Orwell novel, to be honest, because all of a sudden, these people are starting, or some of these people, and I say that, collectively, because there are lots of them involved, are starting to use terms that the public kind of knows and uses commonly, but we don't use them in the same way that clinicians use them. The best one I can think of right now is the word mild. Now, I'm sure some of the people on this call could give you clinical definitions of what mild means. As a consumer, as an individual, mild for me means don't care about it. And in fact, we've seen the impacts to some degree of what using this sort of communication has had. On the public, there are actually members of the public going out and deliberately trying to get infected with Omicron, which is just, it's mind-blowing to me. I mean, I found it mind-blowing when I was sort of fighting through my radio program and other things against people doing that with chickenpox. This is a whole different game. This is a whole different game. It seems extraordinary. It's kind of like saying, I'm going to go and see whether or not those trains really can kill me by standing on the tracks for a while. I mean, this is just not good behavior. There are other examples that are equally problematic that are going around at the moment. And one is the complete and utter misuse of the term mental health. This is being used as a tool and a weapon. And as someone who has done a lot of work over the years, helping people, especially PhD students and academics with issues around mental health, when I hear that term being misused, it means for those who really need that term to be a force that they can utilize, it gets diluted. And, if you know anyone who's had mental health problems, it's already incredibly difficult to navigate the health system and get the support that you need. And to have that word thrown around as though it's candy at the moment, to use as a political and a tactical tool, I actually find really offensive. So we're seeing these terms being used in ways that is really inappropriate. The other part of this that's really problematic for me is the messages that I've been receiving since I've sort of started my own little campaign on this, from teachers and parents. And the ones from the teachers are the ones that bother me the most. And in particular, school principals. They're the ones that are too afraid to speak up publicly because they're worried about losing their jobs. I mean, I'm sorry, what country are we living in? This is really disturbing to me that these people are so concerned about speaking up about the fact that they fear their workplace coming into the start of term 1, that they have to rely on some, radio guy like me to do it for them, which I'm very happy to do and happy to keep doing. This as tiring as it might be. But it stuns me that we're in a situation where some of the best parts of our community, some of the best communicators in our community as well, are unable to do that. I teach a lot of communications workshops, and I often say to people when I'm teaching those, especially to researchers, if you really want to test yourself, go and give a talk at a school, because the kids will be honest. And that's the sort of thing that teachers deal with every day. They're not fools. They're not lazy. They're not just turning up from 9:30 and leaving at 3. They're not taking the entire summer holidays off like some people would have you believe. This is utter nonsense. I mean, I'm a school council principal at my 9-year-old's primary school. I see how hard these teachers work and how much time they put in. And I saw the utter distress that was going around that school towards the end of term 4. I had a phone call with my school principal, and it was over the phone. I'm pretty sure he was in tears on the other end of the phone. I've never seen that from him. He's not a very emotional guy. And he was just distraught because of all the families he'd had to call that weekend, giving them, news that in a relatively low SES community was just devastating because they couldn't go to work. So there's a lot at the moment that's happening where people in incredible positions of power are using those positions to put information out that's inappropriate, that's misleading, and that's problematic. And what is needed is, as many people as possible, like this organization, that can speak up and sort of hold a bit of a blowtorch to some of our leaders and say, hang on a minute, this is not what is appropriate, and you are forgetting an entire group of people here that matters. And at the moment so far, I've only talked about all the healthy teachers that are out there that have absolutely zero other morbidities or immunosuppression problems or anything else. You then start talking about all the people in the community who are in some way at risk because of COVID to a higher degree than everyone else. And if you speak to them, they will tell you how left out and forgotten they have felt. I've been interviewing a little girl on my show every year for about the last 5 years. Her name is May. She has primary immunodeficiency syndrome. I started interviewing her when she was 5 with her mother. She's been wearing a mask for as long as she can actually remember. I remember the first time I interviewed her in 2020 during COVID, she really had little sympathy for people having problems taking precautions, because that was her entire life. And whenever I think about what's going on at the moment, I think of little May and realize that she has been locked in her house for a very, very long time. And she's not alone. There are a lot of similar people, but a lot of these people are about to receive an incredible level of exposure if we do this school thing rapidly. And that's not okay. It's not okay to forget that group. And that group also, coming back to some of the things Bill said, relies very heavily on our healthcare system. And our healthcare system, I'm not sure how it's going in Sydney at the moment. I suspect not so great. We have a brown alert in Melbourne. Things are really not doing well. Even when things were doing a bit better last year, I recall my father had a stroke and he waited 93 minutes for an ambulance. Now, that's the state of the system. It was weakened before this started. It's under incredible stress at the moment. And if we add to that in the next few weeks, we're going to see some really big problems. One of the last times that the brown alert was declared here in Melbourne was during the thunderstorm asthma event just a few years ago. That was an incredibly damaging event for many people. And instead of that being just at a couple of hospitals, it's going to be across the board for us this time. That's really problematic. So I'm trying to do a bit of advocacy at my end to speak for some of the people who are too afraid to do so, and for good reason, I think, for very good reason. I already have a platform, so I can do a bit of that. But I think the more people that sort of write to their local members, I hate that phrase. Whenever someone says that to me, I think, oh God, I'm not doing that. I couldn't be bothered. But, you know, if you want, grab the letter I wrote and plagiarize as much as you like, but I don't care. But, you know, we need to make a bit more noise there and do what we can, because we are, what, is it 8 days out? It's not far. You know, teachers and staff are already back in schools. They're already working. They're already being exposed. It's you know, it's not something we can delay for much longer. So I think I'll stop there, Jane, and people can ask questions. Yeah.
Okay. We'll put it to the Q&A, the attendees now. So Elizabeth, did you have some questions lined up? Yeah. Do you want to, I'll let you ask those.
Hi, good evening. Thank you so much. Everything you've said is exactly what everybody is thinking. So there's been a couple of questions that have been submitted in comments. Kristen says, that's why I'm worried about with my immunocompromised child. She has a hospital protocol which I have to adhere to. If he gets sick, has to be there in an hour. So it's on everybody's mind. It's something that is really critical. Somebody else says, I've written to my schools and asked questions. There's a lot of hesitancy from that to provide straight answers. Instead, lots of referrals to school COVID safe plans and nothing specific. And I personally have experienced that myself. Laura says, thank you, Professor Bowtell. Your insight on the lack of community consultation is so powerful. My question is, what is your advice to small advocacy groups like COVID Safe Schools to encourage our political leaders and opposition leaders to listen to us? Important community voices. Where do we go from here?
Well, going back to the HIV days, we understood very quickly that we could do nothing effective over time on HIV unless we put people living with HIV right at the centre of the policy creation. They weren't consulted in a desultory manner after things had been decided, but they were on all the committees, the scientific as well as the communications committee. And I take Shane's point about communications. I mean, Dr. Blewett, Bob Hawke appointed Ita Buttrose in those days to take charge of communications completely separately to the government. She wasn't putting out government press releases, but, you know, working with the structures we set up. And it goes, we've got to look at the structures that are advising governments. Shane's point about no communications people being on ATAGI and the rest of it, well, there are no really people living with or with the consequences of COVID. And I think people have got to say nothing about us without us. We are not the people at the end of the road who are told what to do by Command Central. The people who are most affected by this, and now there are hundreds of thousands of people in Australia tonight whose livelihoods, whose jobs, whose health, and in some cases their lives are being affected by the consequences of policies put together behind closed doors by unelected and unaccountable committees, which they are. So that's got to change. So if you make one demand of the politicians, and we're still a democracy and we've got an election coming up, good, you put it to them. And you say these structures have got to change, not just in principle, but because what they've delivered has not been very good. That's obvious to anybody outside that bubble. So I think there's a time to be in a polite and caring and sharing way to go to the politicians and say, what are you going to do to change it? We demand change in the nature of these committees and the advisory structures. And if we want to talk about schools, then you put together a comprehensive and inclusive and sensible committee that can grapple with this in a policy sense. And I accept that we're in a very difficult situation. And most of the people in these arrangements, their hearts are in the right place. but the structures themselves are wrong. And there's not going to be a magical solution that allows us all to go back to school and not get COVID or be affected by it. That's not going to happen. But it's difficult, and the people of goodwill have got to be drawn in and not just restricted to a very small number of people who, frankly, have not done very well in the last 2 years. So structurally, it's structurally important. You know, that's the structure has got to change and be opened up, and all the voices are heard, and that becomes the basis of the policy recommendations to governments.
And Shane, did you want to comment on that, or I could?
Yeah, I mean, the only thing to add there really is around as I said, the communication thing. And I noticed in one of the questions there was a comment around how to flip that around, some of this around, and part of it for me is actually using their own words against them. For those of you who've been following me on Twitter, part of what I've been doing is saying, look, we were given really clear instructions on what was needed last year from some of the health experts with regards to, you know, vaccination, ventilation, you know, other bits and pieces, all the other V's apparently that none of us in Victoria can remember. And this is something that we said, okay, we'll trust you for a moment on this, and this is what we'll do to keep things in check. None of those things are in place for term one. There is partial vaccination. There is, you know, it's partial everything. And we're in the biggest wave we've ever experienced by a factor of, I'm not sure what's the number today. Is it 50? You know, you can't tell, right? There's a factor of 50 over last term. And so to me, the way to flip it around is to say, okay, you know, we trusted you. We will do exactly what you said was required for it to be safe for everyone involved. Now, the problem is at the moment, we're not meeting those criteria, any of those criteria. And I'm one of these people, I want my kids back in school. I desperately want to, you know, despite the fact that when I sent my 14-year-old back to school in term 4, he broke his knee, I still want him to go back to school again, you know, so faster he gets back, the better. But I don't want to do that at the expense of so many of the teachers and the staff at schools. And I certainly don't want it in a way that says to my 9-year-old, you can no longer visit your grandparents. You know, we need many of those protections in place, and we haven't done that yet. So to flip it around for me is say, okay, this is what you've said we needed to be safe. And there's heaps of examples of that. In fact, in Victoria, our chief health officer, Brett Sutton, tweeted on Sunday exactly what was needed for kids to be safe. And I'm not sure if that means he's shifting to this point of the argument, which would be nice. But, you know, I just grabbed that tweet and I actually cut and pasted that into my letter to the Minister for Education here in Victoria, because I thought, this is not me making the case. This is your own people making the case. And, you know, we actually trusted that and we believed in that. So let's just do that. That sounds like a really good idea. And that means a slight delay. The problem we've got is this black and white thinking, extremely weak strategy. And you cannot have a scenario where you have weak strategy people running these particular adventures. You know, you cannot have weak strategy people running these sorts of scenarios, because it is difficult, it is complex, and there are many pieces. There is a world of space between completely locked down in home and face-to-face learning for all. There is so much between those two things. And yet it seems as though they're the only two options that are being discussed at the highest levels. It's just weak strategy, and we need to move on to something more complicated for a complicated situation.
Okay. Are there any other questions, Elizabeth, that you've identified? Yep.
Yes, I've got 3 more.
Okay.
There's a question. Do you think schools or any indoor environments can be safe with any level of community transmission with this very infectious variant?
Want to go first, Bill?
Well, look, probably for the great benefit of the health of the people of Australia, I'm not a doctor or an epidemiologist. So on these questions of the, you know, of the virus and transmission, I defer to people like Brendan Crabb and Raina McIntyre. But as a practical point, I'd say obviously as we go into autumn and winter, students are going to have to be taught indoors to some degree, and therefore, the ventilation questions and standards and monitoring of those and the setting of those becomes exceptionally important. And what also becomes very important is daily reporting of data and effects and impacts, so that we know really what's going on as children come back to school. As I said, none of this is now perfect, and we're not going to have 100% safety in the schools, it seems to me. But our top epidemiologists, our top ventilation people, have to be right there at the front and center, at the heart of the policy that's now going to be created over the next several months.
I agree, Bill. I have a colleague of mine, an old colleague named Robin Schofield, and she, when I first met her, was doing air contamination studies in Antarctica from the Northern Hemisphere. And no one I know knows more about airflow and contaminants and particles than she does. And she's done a lot of work here in Melbourne with regards to HEPA filters and recommendations for those and so forth. She's at the University of Melbourne. Why, as Bill says, that person is not front and center right in the middle of this, when most of the discussion at the moment is around exactly this problem? I mean, we know the vaccine bit, right? We know that bit. That's easy. In fact, the only problem we've got there seems to be supply. And we drop the gap between 5 to 11-year-olds down to 3 weeks in a flash if we had supply, but we don't at the moment, it would appear. So the other big piece is ventilation. And it's interesting, Bill, you mentioned in winter, but I haven't come across a single teacher that's happy with the idea of teaching on a 35-degree day with all the windows open, wearing a mask for 6 hours. I know for me, my comfort level, craps out at about 26 in the house before I'm reaching for the remote. So I think it's unreasonable to expect teachers and students to concentrate in those environments. And I realize there's been some really inappropriate commentary around, babysitting and so forth, but I think everyone realizes that's nonsense, I would hope, and that you need kids to be thinking sharp and engaged, and they're not. I grew up in the like many others, I grew up in the 70s when air conditioning in schools wasn't a thing. I remember those days. They were dreadful. You couldn't think to save your life, and we don't want to go back to that. That's not going to work. And a lot of kids are affected by hay fever and other allergens that are really detrimental. I know my son, if he's my 9-year-old, if he's at school under these conditions, he'll last about 3 hours before I get a call to go and pick him up. And teachers are the same. It's not a reasonable outcome.
Is any more questions there?
We've got a couple more, if I may ask, please.
Yep.
So the next one's: current discourse on this issue has centred on protecting the rights of children to experience education in a safe and consistent environment. Given the recent government language that has framed teachers as surrogate babysitters, how do we combat this rhetoric through the voices of teachers who clearly care about their kids' education, have valuable knowledge on learning in a pandemic, but are also entitled to a safe workplace, protecting their own health and safety?
This is an interesting one, Elizabeth, that I've had a lot of comments coming to me over the last few days on. I think a big part of this is really reframing what's at stake here. So one of the things I haven't heard a lot, a point I try and keep making, is we're going to have kids coming home in the next few weeks if we return to face-to-face learning, guaranteed. The part of it we're not going to really like, beyond them getting sick and teachers being sick and so forth, is the random nature of those calls that parents will get. It will be random. So when we're talking about disruption, doing it the way that it is currently planned in Victoria and New South Wales will maximize the level of disruption to kids. Kids like stability. That's not what we're going to be giving them. Education requires stability. That's not what we're going to be giving them. So if you want stability and you want to maximize kids' education, then and maximize the safety of everyone involved, then a short delay while we get some of these required interventions in place will be really valuable. And it doesn't, you hear people talk about, I'm not doing another year of homeschooling. I'm thinking, I don't want to do that either. But 4 to 6 weeks is not going to damage their mental health. If it was, we wouldn't have let them just have a big holiday break, because that would have been similarly problematic. That's a nonsense, and we need to call that out. I think we also need to be really careful that we're making the point that, teachers, like anyone in the other workforces that we have been caring for in various ways, require us to stand up for them. I mean, every 5 seconds at the moment, a health service worker is referred to as a hero. I have no particular objection to that, but I'm not hearing that about teachers. I'm not hearing teachers being talked about in the same way with the same esteem. And this is not for teachers to do. This is for the rest of us to do. It's one of the reasons why I've been doing what I've been doing, is because I know a lot of teachers don't have that voice. And I think if someone doesn't stand up for them, they're just going to be thrown under the bus. And that seems to be what's happening in Victoria and in New South Wales en masse at the moment.
Thank you. And I don't know, Bill, if you wanted to.
No, I agree with
Okay.
on that particular.
Okay, so there is one more question here, and I actually, if you have time, maybe pop in another question at the end. Elizabeth, I think I might get you to answer the next question, and I'll finish up.
Sorry, next question. How do we get a voice in National Cabinet?
Well, by demanding it. I mean, I saw on there saying, well, somehow the backbench members have been sidelined. Well, they don't see themselves as sidelined. And it's time that a lot of pressure went on those members of Parliament on all sides to say that what has gone on has not been good enough. And it's time for the structures to change. And it's time basically for the default position to be total transparency of the advice that's given to these committees upon which these policies are made. Now, obviously there's going to be disagreement. There's going to be debate, but that's not a bad thing. That's a very good thing, because the more debate there is, the more points that are contested, and the more the understanding of the data and the evidence is put out there, well, in the end, the stronger the policy is going to be. So it's no use coming up with a set of policy proposals, as seems to happen, that don't seem to involve teachers, much less parents or students, in the consequences that will happen if you implement them. And then they have to be changed, as we're seeing what's happening now. So it's time for these structures to change. It's time for the pressure to go on the politicians. And the ones that have not worked well, and I think National Cabinet is a very equivocal structure at the moment, frankly, in terms of its success of its outcomes, then they've got to be transformed and reorganised. If we don't do that, we look into 2022, as Kerry Chance said only yesterday, that we will have recurrent waves of infection, that when kids go back to school, cases will go up, and this thing will just keep grinding on. You know, sand in the gears. And this is what's got to change. It's not worked well. So the demands have to be made by groups like yours, by parents, by teachers' unions, by everybody, of the people who can change these things. And those people are the Prime Minister and the Premiers and the relevant ministers.
Thank you, Bill. And I'll just finish up with one question. So just in terms of a snapshot of where Australia is, and, you know, the need to communicate the fierce urgency of now. It was Martin Luther King Day yesterday, so it's a famous phrase from him. And I really do believe there's a fierce urgency of now. I mean, 3 years into this pandemic, and today Australia is neck and neck with France for the top spot in the number of cases the last couple of days. We have really a shadow lockdown, so the economy is in the pits and critical services are on the brink of collapse. We've got staff shortages, especially going into school and other areas, that other critical services, healthcare, and our basic infrastructure. There's been no assurances from Department of Education across various states. We're waiting for the National Cabinet. They've held off for, and it's days away till school. So, you know, total breach of trust and no leadership. And we have a vaccination program where most 5-year-olds will only have 1 dose at the start of school. 12 to 16-year-olds won't have a booster. They're not available yet. And some teachers haven't been able to access boosters. So the protection from vaccines will not be there. We have rat shortages, which you've mentioned, and price gouging on those. And I think, interestingly and importantly, there's the mounting evidence that COVID can cause long-term damage to all organ systems, even after the mild and asymptomatic infections. And I think what I sent you a message earlier in the week, Eric Feigl-Ding tweeted about, they've now evidenced that T cells get damaged by COVID the same way that HIV and other RNA virus damage T cell immunities. And so all of those things kind of should really, make it a pressing issue that we get out there and really advocate for the best practice. Basically, we don't have time. The next variant is likely around the corner. And my question is, let's pretend there's no financial constraints. Government can do whatever it takes. What would be the best thing to have happen right now? It's a big question. So sorry to throw it on you, but if you are happy to answer that, I'd love to hear what you have to say. Thank you.
Well, if I can say very quickly, as I said before, almost the greatest vaccine of all is money. There are no financial constraints. The idea that this because in principle and in fact, the governments of Australia can do what they want. The governments of Australia, with their eyes wide open, delivered the policies that have created the situation we're in tonight. So with eyes wide open and with more money applied to sensible policy, we can start to turn things around, or at least do the maximum we can to protect our children and the vulnerable and the entire community from what's going on. That's not beyond the wit of any of us if we structure it properly. But the idea that money is a limiting factor at the moment, and therefore ventilation is impossible, but or rat test can't be given free, is simply preposterous. Simply preposterous. And the costs incurred in doing the right things now will be repaid in dividends within months if we don't have that additional illness. But what we've got now is the worst of all worlds. We've got massively rising caseload, with goodness knows the consequences for people in the health system locked in now for the next years. The demands on the health system are only going to go up thanks to what's going on and the caseload we've generated. And the idea somehow that spending money, taxpayers' money on protecting the people is almost inconceivable. Well, it's just silly. It doesn't stand up even to the most basic analysis, but to the extent that it should be knocked out of the court, in my view. And we've just got to get on with protecting the people rather than infecting them.
Yeah, I agree. Thank you, Bill. And I think, I think getting permission for radical policies, I mean, they're not radical, actually. We have a lot of tools that are very simple. And I mean, we just,
What's radical about the idea that the purpose of government and the public health system is to stop or prevent terrible infections from spreading in our community?
That's it.
Have we come to the point that this is a radical proposition? I don't think it is.
No, not at all.
Proposition I've ever heard.
Jane, if I can add to that, I agree with everything Bill's saying there, and it's quite fascinating to me, because as someone who's been a professional scientist, I'm not anymore, but I was for over a decade. And one of the things we often struggle with is there's a lot of unknowns, and it requires a lot of work to get through those. And science evolves in incredible ways as a result of the hard work of many. But the scientific unknowns that are like we're struggling with at the moment aren't the ones that are restricting us here in Australia. We know how to do the ventilation. We know how to do the rapid test. We know how to do the PCR test. We know how to protect people in many ways. We know how to take care of our health service workers. We know how to pay them more. We know how to pay our teachers more and respect them more. All of these things we know how to do. We don't have a limitation in terms of science or even what's required in policy. We simply have a lack of will. And that's the big piece that seems to be missing here. And even I was thinking about this the other day, and I said to a friend of mine here, I said, look, if we fail on everything else in Victoria, maybe we could get our government here in Victoria to make these changes just to make the New South Wales government look bad. They seem to like doing that normally. Maybe that's our best approach if everything else fails. Now, how ridiculous would that be if that was the answer? But, you know, the answers that we need are so simple. They are so simple, and they're right in front of us, but we completely lack the will. And unfortunately, some of our media organizations, some that I've respected for many, many years, are failing to put out the right information on this, and instead are putting a few very narrow-minded people on all the time that are delivering information that is inappropriate, that's problematic, and has done nothing but damage things over the years. I mean, I cannot believe that on occasion we still have to talk about this being aerosol. This blows my mind. My wife and I bought our HEPA filters almost 2 years ago. I mean, seriously, this is so simple. We lack the will, we don't lack the science, we don't lack the technology. Our immunologists are doing their best to keep up with this, and they are doing a great job. I remember a couple of years ago when we were begging for a vaccine. We would have done anything for a vaccine. And now we've got one. We've got one that works well, but we need the other bits and pieces to help it along the way.
Thank you. Excellent. And yeah, I really appreciate hearing your views, and I agree with nearly everything I think you've said. And I can say a final thank you. And we'll move on to our business. Yeah.
I'll say thank you, but it's been a great pleasure to be here this evening, and I really wish you well, and keep pushing on, to coin a phrase.
Yeah, same for me, Jane. You know, just all I can say is keep telling them what you need. You know, don't complain too much about what's happened in the past, but, you know, focus on what we need coming up in the coming weeks. That's, I think, the best way to campaign with this stuff. And, you know, reach out to people like me and Bill and others. We'll do what we can to help you with what small followings we have, but, you know, we'll do our best. Good luck.
Thank you. And yeah, we very much appreciate your sharing your expertise. And I think we have a lot of respect for your position in media, and your willingness to support us, and yours too, Bill. And so very much appreciate you coming tonight and being so generous with your time.